Hi, my name is Bertrand Dirk, and today we'll be discussing about what chronic daily headache is. Have you been diagnosed with this condition or may think you suffer from chronic daily headaches? Well, today we'll be going into greater detail to better understand what chronic daily headache is, as well as understanding the potential cause of why you may be suffering from this condition, as well as potential treatment options to help treat and manage chronic daily headaches. So, chronic daily headache is a broad definition that includes any headaches that occur for at least 15 days in a month, and this must occur over at least a 3-month period. And this can include many different types of headaches, such as cluster headaches, paroxysmal hemicrania, and SUNCT. However, the most common types of chronic daily headaches are chronic tension type headache, new persistent daily headache, chronic migraine, and hemicrania continua. So, it has been reported that chronic daily headache is experienced by at least 4 to 5% of the population worldwide and would account for at least 30 to 80% of all headache types. So we'll go into greater detail of certain chronic daily headaches. So the first one that we'll discuss about is chronic tension type headache. Do you suffer from this? Well, let's go over what the details are. So chronic tension type headache is classified as a mild to moderate headache pain that is usually felt on both sides of the head together at the same time. It is often described as a feeling of a tightening or pressing or compression of the head, almost like as if you're wearing a very tight helmet and it is just squeezing like a vice around both sides of the head, as opposed to a pulsating type pain, which is often experienced like a migraine type pain. So, if you have chronic tension type headache, remember, you will have pain that exhibited on both sides of the head, which is more like a tightening or squeezing type pain. Now, the next condition is called new daily persistent headache. So, new daily persistent headache is somewhat similar to chronic daily tension headache. However, they occur to people who have had no prior history of headaches and generally occur out of the blue. Generally, these headaches will become constant or near to constant within 3 days of the onset of the first headache. Similarly to chronic daily tension type headache, these occur and often have a description of a tightening or pressing type of sensation, and remember, not a pulsating type pain. Pulsating type pain is usually experienced with migraine sufferers. So, let's go over into chronic migraine. Do you suffer from this? And remember, all of these conditions that we're describing, you must suffer from at least 15 days out of the month and have it for at least a 3-month consecutive period. So let's talk about what chronic migraine is and the difference of it as well. So, chronic migraine usually is a progression of episodic migraine that worsens over time to become more persistent. These migraines may have gone untreated or may have progressed naturally over time. Now, migraine pain is usually experienced on one side of the head. However, it may switch from side to side, from left to right side, and may even switch in between an attack as well, from different sides. Now, the pain is usually described as a throbbing and pulsating type pain that is usually regarded as a moderate to severe pain in nature. Usually with migraine or chronic migraine, you may also experience aura, which is visual disturbances prior to the actual migraine pain. You may have nausea and vomiting, as well as being sensitive to light, sound, and smell. So, we'll now go over to hemicrania continua. Have you heard of this term at all? And do you suffer from this? Well, let's go into greater detail. Hemicrania continua typically affects one side of the head, but will usually be side-locked and will not switch sides. So, if you have pain that is on one side of the head and is always on one side of the head, then you may experience hemicrania continua. Now, people who experience these headaches will have moderate pain throughout the whole day, with more severe spikes intermittently throughout the day as well. Now, it is important, or it is possible for people to experience other symptoms with hemicrania continua, such as a swollen or droopy eyelid. Do you also have a red eye? Or do you have a blocked or runny nose, or even a watery eyes? So, some symptoms associated with migraine can occur, such as nausea and sensitive to light, sound, and smell. However, hemicrania continua, remember, will only be locked on one side of the head, and you will have a lot of features with that eye. For example, remember that droopy redness of the eye or the swollen eye. That is what hemicrania continua is. So, let's now talk about what chronic daily headache is. The causes, remember, chronic daily headaches can be hemicrania continua, can be chronic migraines, can be new daily persistent headache, and even chronic tension headache. So the broad umbrella term is chronic daily headache. So what is the cause? Now, the most recent research actually suggests that chronic daily headaches results to the problem from the upper cervical spine of the neck, the first 3 vertebrae of the neck. Now, these patients have shown to have an upregulated trigeminal cervical nucleus, the TCN, which is a part of the brain stem. Now, usually when the trigeminal cervical nucleus is upregulated or very sensitive, it now causes the brainstem to be hypersensitive. This then interprets information coming from the nerves in the neck incorrectly, and then sending pain up and over into the head. The pain referred from a sensitized brainstem is often what sufferers of chronic daily headache are experiencing. So, usually the research is now pinpointing to the neck and the brainstem to be the actual cause of chronic daily headache. So, what are the treatment options? Well, firstly, we can let you know that people that come to see us, it is not uncommon that they have tried almost everything. All types of treatments or all therapies or even surgical intervention with little or minimal success. Now, a big reason why this is the case is because most practitioners don't attempt to identify the underlying root cause of the headaches. So basically, at our clinic, we use the experience that we have gathering from seeing countless of patients with chronic daily headaches, and we utilize the most current and up-to-date research to assess, treat, and correctly diagnose these types of condition. And we do this by basically assessing the trigeminal nucleus and the brainstem by assessing the first 3 vertebrae of the neck. So my question to you is have you had your neck thoroughly assessed by a headache consultant and by assessing potentially how sensitive your brainstem and the trigeminal cervical nucleus is? Now, if you haven't, then I would strongly urge you to assess this, as this may be the underlying root cause of your chronic daily headache. And if that is the case, then treating the sensitized brainstem will be your primary focus in order to try to alleviate, manage, and treat this condition. At our clinic, we do this by assessing the first 3 vertebrae of the neck, and I would thoroughly suggest that you have this assessed to hopefully finally end chronic daily headaches. Because as you know, chronic daily headaches is unrelenting. It is there constantly or near constantly all the time. The pain may be moderate to severe, but what is the most severe part about it is that it is there constantly. That is one of the biggest killers of what chronic daily headache is. So, my name is Bertrand Dirk. I hope you have found more valuable information, a better understanding of what chronic daily headache is, and hopefully this will guide you to now seek further help and understand and assessing, most likely, the brainstem and whether or not this may be the cause of your symptoms. Once again, my name is Bertrand, and I look forward to seeing you at another video. If you have any further questions, feel free to comment below or contact us through our channels here. Thank you.